My name is Madison Riffle, and this is my Project 2 Assessment Interpretation to a Parent for Dr. Sales EPSY 6316 Masters in SPED class. So the student that we are reviewing her results today, her name is Bailey Lynn. And we're going to start here with this first section. So this section, the student had notable variability in her scores across subtests. If I were explaining this to a parent, this is how I would explain the results. So when we look at your child's overall intellectual abilities, we use something called a full scale IQ. This is noted as the FS IQ in this report. And this score gives us a general idea of how your child thinks, learns, and solves problems compared to other children her age. So Bailey Lynn's full-scale IQ score was 78, which places her in the very low range, also in the 7th percentile. So this means that when she's compared to her same-aged peers, Bailey Lynn scored higher than about 7% of children and lower than most others. This is important to know that this score was strongly affected by two specific areas where she had difficulty: verbal comprehension, which would be the understanding and use of language, and her working memory, which involves remembering and using information in the moment. So in all other areas of thinking and problem solving, Bailey Lynn scored in the average range, which means those skills are on track for her age. So because Bailey Lynn already qualifies as a student with a speech and language impairment and showed significant difficulty on tasks that rely heavily on language, I, as the evaluator, also looked at another score called the nonverbal index, which would also be abbreviated as the NVI. And so the nonverbal index consists of subtests that minimize expressive language demands. So when we are reducing the impact of her processing deficit and verbal comprehension, her general cognitive abilities are in that average range compared to other students her age. So she had a standard score of 90, putting her in the 25th percentile rank. And so this specific score, the nonverbal index score, focuses on problem-solving tasks that do not depend on speaking or understanding language. So when we are looking at her thinking skills without that impact of language, her nonverbal index score, like I just said, was a 90. So that falls within the average range, within that 25th percentile. And these scores suggest that her general thinking and problem-solving abilities are stronger than what that full-scale IQ alone shows. So in other words, when we reduce the language demands, Bailey Lynn's abilities appear more in line with what we would expect for her age. So moving on to this second section, academic achievement. So to better understand how Bailey Lynn is currently performing in school-related areas like reading, math, and writing, she was given the Woodcock-Johnson Test of Achievement. This is abbreviated as the WJAIV, to evaluate her current levels of performance in the academic areas. So this assessment helps us see her current academic skill levels compared to children her age. So her scores on the Woodcock-Johnson Test of Achievement show that she is performing well below the expected level for her grade in the areas evaluated. So now I'll walk you through what each of these scores means. Her brief achievement score was a 62. So this score suggests that when we look at her overall academic performance, she is performing at about the level of a 4-year-old, a 4-year, 10-month-old. Her academic skills score is a 62. And what this means is that this score encompasses basic skills such as reading words, spelling, and solving simple math problems. Her performance here is similar to that of a 4-year-old, that's 4-year, 8-month-old. Her academic application score was a 65. So that's this one right here. And this measures how well she uses academic skills in more real world or applied situations, such as solving story problems, word problems, or writing sentences. And her performance in this area is similar to that of a 5-year-old, 2 months. So 5 years, 2 months old student. So overall, these results show that Bailey Lynn is significantly behind her same-aged peers in reading, writing, and math. And this information collectively helps us as the ARD committee determine what types of support, specialized instruction, and accommodations we can provide that will best help her make progress in the educational setting. The next test that she was administered is called the Developmental Test of Visual Perception 3. This is abbreviated as the DTVP3. And this test was administered so that I could take a closer look at her visual processing skills. This test was recommended because of the difficulties that she showed on her earlier cognitive testing. So within this visual processing section, I wanted to better understand her visual abilities without the influence of motor skills like drawing or writing. So she was given the motor reduced visual perception portion of this test. So this means that the tasks focused only on how well she sees and understands visual information, not specifically how she uses her hands to manipulate that information. And so the skills that were measured included the figure ground area, which is like finding a shape or picture hidden inside a busy background. Visual closure, which would consist of identifying a picture when only part of it is shown. And then form constancy, which is recognizing shapes or objects, even when they are different sizes, turned in a different direction, or they are shown in a different way. And so those are the 3 subtests that she was administered. So again, it was the figure ground subtest, visual closure subtest, and the form constancy subtest. So the results from these, from the figure ground subtest fell in the below average range. So she did score within the 9th percentile in that area, which says that she performed at or the same as about 9% of students in her age range. And she performed in the very poor range, so below the 1st percentile on the visual closure and form constancy subtests. So these results show that she does have significant challenges in the area of visual processing, and this may affect her ability to read, write, copy information, and understand visual materials used in the classroom. The next section that we addressed was her adaptive functioning. So Bailey Lynn's mother, completed the report from the Adaptive Behavior Assessment System 2. This is abbreviated as the ABAS 2. And the ABAS is a tool designed to assess adaptive functioning, like life skills, across 3 main domain areas. So to better understand how Bailey Lynn handles everyday life skills at home and in the community, in the school setting, this is why I asked you to complete that questionnaire over her adaptive behavior, so that we could look at how she independently completes age-appropriate daily tasks, which would include things like communicating, taking care of herself, following routines, and interacting with others in the school and home environments. So the ABAS-2 provided us with an overall score that we call the General Adaptive Composite. This is abbreviated as a GAC. And Bailey Lynn's GAC score was a 72, which falls in the borderline range, also within the 3rd percentile. So she did score at or the same as 3% of students in her age range. This means that overall she does show more difficulty with daily living skills than most children her age, and her strengths and weaknesses do vary across different areas. So of those different areas, we looked at 3 different domains, and the first of which was the conceptual composite, which evaluated her communication skills, functional academics, and her self-direction. So communication scores, or I'm sorry, her and the conceptual skills that address the communication, academics, and self-direction, she obtained an overall score of 72, which is in that 3rd percentile and in the borderline range. So this area specifically looks at skills like understanding and using language, completing schoolwork, following routines, and solving everyday problems. So in communication, she fell in the low average range. So this helps us understand that this is a relative strength for her. Her functional academics, she fell in the borderline range, and same with self-direction. So she fell in the borderline range for self-direction. So that might look like difficulty starting tasks, staying organized, or managing her routines independently. So she does show some strength with communication, but she still does need support with academic related tasks and learning to manage, tasks independently. The second area that we looked at were practical skills. So this would include home living, self-care, community, health and safety. Areas of that self-care specifically, we looked at feeding, dressing, and hygiene. For community, how does she navigate her surroundings of her community, the school, at home, and then those health and safety guidelines as well. So Bailey Lynn's practical composite fell in the borderline range. So her skilled standard score was a 72, placing her in the 2nd percentile. Her home living skills were reported to be in the average range, and self-care was in the borderline range. Community use and health and safety guidelines were in the extremely low range. So for home living, I was able to obtain information that shows that Bailey Lynn can complete simple household tasks at a level expected for her age. So this area would be an area of strength for her. Self-care, she did fall within that borderline score range. So she does need help with things like feeding, dressing, hygiene, community use, and health and safety. She did fall in the extremely low range with those 2 areas. So she likely will and does have difficulty navigating everyday community situations, and she will need significant report to follow safety rules and recognize potentially unsafe situations. So these results do show us that she has some strengths in these areas, but she does need substantial support in important day-to-day safety and community skills. The third area is the social skills area, also known as the social composite. And this area measures how she interacts with others, plays, and engages socially. So her overall score in the social composite was a 98, placing her in the 45th percentile. So this area, also falls within the average range. And so her social skills, her social composite score is a notable strength for her. So this generally means that she interacts with others in an age-appropriate way and has typical social and play skills. So overall, Bailey Lynn demonstrates strengths in social skills and home living, but she needs support in areas related to independence, safety, self-care, academics, and navigating her environment. These results help us again to understand what support she may need at home and in school to build her independence and daily living skills. So the next area that we looked at is behavior. So over the past week, staff recorded several situations in which Bailey Lynn engaged in self-injurious behaviors, including biting herself and banging her head. These behaviors happened during different parts of the school day, including in English class, the cafeteria, art, and during transitions. And so this table that we have here, we recorded the date, time, antecedent, behavior, consequence, and then comments and function. So the date and time, pretty self-explanatory. This is just, the date and then the time that the incident occurred. Antecedent is just what happens immediately prior to that behavior occurring. So antecedent behavior is what was observed to occur as the problematic or troublesome behavior. And then consequence just means what happened immediately after the behavior occurred. So this is not necessarily anything negative. It was just what happened immediately after Bailey Lynn engaged in this specific behavior. And for the purpose of this data collection, the comments/function would be the setting in which the behavior was observed. So looking at all of this information, across these incidences, there is a clear pattern that was observed. So most of the behaviors occurred when Bailey Lynn was interrupted, spoken over, or maybe not given the chance to communicate her thoughts, finish her sentence, or have her needs understood. So for instance, on 1020, the student interrupted, or Lacey, another student, interrupted Bailey Lynn's question to the teacher in an effort to speak for Bailey Lynn. So this happened immediately prior to the observed behavior, which was when Bailey Lynn began biting herself. She did not break her skin. And then immediately following that behavior, the teacher assistant removed Bailey Lynn from the cafeteria and away from Lacey, and this occurred in the cafeteria. The next incident on 1021, another student named Max answered the teacher's question, even though Bailey Lynn had her hand raised. As a result, Bailey Lynn hit her head against the wall 3 times before the teacher could stop her. She continued to attempt to bite and bang her head on objects. And the consequence or action immediately following Bailey Lynn's behavior was that the students were moved away from Bailey Lynn, and then Bailey Lynn was she was removed from the class. And so this specific incident happened in English. 1021, cafeteria staff asked Bailey Lynn to repeat her request for condiments. Bailey Lynn began biting herself. She bruised her arm in the process. And then immediately after that, the TA removed Bailey Lynn from the lunch line and took her to the hallway to eat. So this occurred in the cafeteria. On 1022, as Bailey Lynn was answering a question, Max interrupted her and answered for Bailey Lynn before she could finish. So the behavior as a result of that antecedent is that Bailey Lynn began slamming her head on the desk. And then the consequence was that she was asked to step out of the room and sat with the special education teacher in the hallway for approximately 15 minutes, most likely to cool down and talk through the events that had happened. And this was an English class. Next would be on 1022. There was a substitute that day. And in this particular instance, the substitute answered, yes, the buses are coming, to Bailey Lynn's question about wanting to know her new bus number. So Bailey Lynn was inquiring about something specific, which was her new bus number, and her question was not answered adequately. So she did drop to the ground, bit herself on the hand, and then began banging her head on the ground. And so after that, she was escorted to the office by the assistant principal, where she remained in the AP's office until she was dismissed. And this incident did occur in art class. Again, there was a substitute that day, so that could have contributed towards those behaviors. On 1024, Bailey Lynn asked if pizza was available for lunch and was told no. Unfortunately, she then began banging her head against the cafeteria wall and then attempted to use items on her lunch tray to hit herself. The TA removed Bailey Lynn from the lunch line and took Bailey Lynn and her lunch into the main office to eat. So this occurred in the cafeteria. And then on 10/25, Bailey Lynn and a friend were talking, and the friend left the conversation before Bailey Lynn had finished her sentence. That led Bailey Lynn to bite her upper arm, and she did break the skin. She also bit her hand, right ring finger, and right wrist, and she did hit her head with her right palm. And so the consequence or action immediately following that behavior was that Bailey Lynn was asked to step outside of the room, and she sat with the TA, the teacher's assistant, in the hallway for approximately 30 minutes. And this incident occurred in English class. So again, across all of these incidences, the behaviors were observed to occur when Bailey Lynn was interrupted, when someone spoke for her, maybe she was not allowed to finish communicating, or when she felt ignored or misunderstood. And so, these patterns suggest that her self-injury may be related to communication frustrations. So in other words, these behaviors may occur when she feels she cannot, adequately express herself, or when others do not give her the space or time to communicate. And then the last area that we will look at is some duration data that was collected. And so this data was collected to help us better understand how long Bailey Lynn remains upset or unsafe during episodes of self-injury. And so staff collected duration data between October 20th and October 25th. And this means that for each incident, we recorded how long the behavior, lasted. So starting from the first sign of self-injury, which might have involved biting or headbanging, and then it ended when Bailey Lynn was calm, safe, and able to return to her assigned activity. So these behaviors did occur in several settings, including the cafeteria, English class, and art class. The duration varied from day to day, but overall the episodes were pretty lengthy, showing that once she becomes upset, she does need significant time and support to recover. So for instance, anytime that the behaviors of concern that included self-injury, biting, headbanging, they started that timer and took data on how long it took for her to initiate that concerning behavior and then when it was finally concluded. So if you look here on 10/20, this lasted approximately 15 minutes, 10/21, 18 minutes, 17 minutes, 10/21 as well. The longest observed behavior here was that art class incident on 10/22 where the substitute was present. And then the shortest duration would have been in the cafeteria on 10/24 where she was observed asking if pizza was available. And then when she was told no, she was banging her head against the wall and then attempted to use those items on her lunch tray to hit herself. And so what all of this data here tells us is that across the week, the episodes of self-injury ranged from anywhere from 8 minutes to 36 minutes. However, most of the incidences lasted between 14 and 20 minutes. So again, this does show us that when Bailey Lynn becomes upset, she does need a long period of time to calm down and get back to that regulated behavior. These behaviors do significantly interrupt her learning and daily routines. And she likely needs more support with emotional regulation, communication, and coping strategies so that we can help her prevent the behaviors from happening and also provide her with the tools and strategies to utilize to help her recover more quickly when these behaviors do occur. So all this behavior data as a whole is very helpful for us as the ARD committee because this is how we determine what kinds of supports, interventions, and accommodations will best help Bailey Lynn remain safe, as well as give her those tools and strategies to help reduce the behaviors so she can stay engaged in learning.